Greetings, hey, Dr. Brandon Nilsson here with today's prescription. Today's prescription without all the harmful side effects is posture, especially in the low back. You know, I see a lot of people in this computer day and age where we're sitting at computers, this information age, and we kind of start slumping over. And I'll have people come in and they'll say, oh, my back hurts, you know, and it hurts right along this area or it hurts right in this area, all right? When it's isolated to one side or when it's general low back pain, usually what's happened is that base right at your sacrum and your pelvis has shifted. So one of the best ways to help shift that back is to be able to sit up straight, but I'm going to show you a little tip. I use it oftentimes with pregnant women and where their pelvis starts shifting and they'll get pain. You can't really, it's more difficult to go in and adjust a pregnant woman. So I'm going to allow you to use your own body weight to shift your pelvis and low back so that it can stop hurting. Let me show you. What you're going to need, the tool you're going to need is a book. Now this is a little bit too big. This is about 1.5 inches, whereas this is just about right, about 1/2 inch, maybe 1 inch slightly, but you're going to want, depending on how hard your chair is, you're not going to want to go too high. And I'll show you what you're going to do. So I'll put this book away. What we're going to do is we're going to place it right underneath just half of our bottom, right? So just one side, you're going to put it right underneath the ischial tuberosity, so your sits bone, okay? And what I'm going to do is I'm going to sit up straight. So generally people will sit like this. So to correct that, you're going to sit up straight. Then the next thing you're going to do is actually place the book right underneath. So let's say I have sore back on the right side. I'm going to place that right underneath the right side only. Then I'm going to sit there for about 3 to 5 minutes. And I'll just sit there, do my work. I want to make sure that I have good posture, especially in that low back, all right? Good posture, sitting there 3 to 5 minutes has expired. Now, let's say that starts getting worse, all right? It should actually start to get better and feel better. If it starts getting worse, you actually need to try it on the other side. So you can kind of play with that, alternate back and forth. Again, this is just a tip. I'm not saying it's going to fix you. Really what you need to do is go to a chiropractor, but just at home, this can help alleviate some of that low back pain. I'm Dr. Brandon Nilsson, and remember this, do live in wholeness every day. Make sure you subscribe, like us, all those good things, and we'll see you on the next video.